We've all seen it or experienced it ourselves. In a traditional classroom, the instructor lectures in front of the class while students take as many notes as possible. Students receive the same content at the same pace set by the instructor, regardless of their ability. One student may already understand the content and be bored, while another student is lost. Because the pace of content delivery is set by the instructor, students don't have time to digest the material and ask the probing questions necessary to further their understanding. In a traditional teaching model, time outside the classroom leaves students trying to recall what the instructor said to complete the homework or study for assessments. Some students get the homework done quickly and accurately, while other students struggle and get frustrated.
However, in contrary to the traditional model, a flipped classroom inverts the structure of when students learn foundational content and when they apply it. In a flipped model, students gain first exposure learning prior to class through lecture videos, supplemental reading, and other supplemental resources. Content in the lecture videos targets lower order thinking skills on Bloom's taxonomy, like understanding, remembering, and lays the foundation for students to acquire new content through complex questioning, instructor modeling, or problem set solving. Students have direct access to the knowledge in these lecture videos and can watch them at their own pace. The instructor no longer dictates the pace of foundational content knowledge acquisition. By introducing the content before class, students can focus on processing their learning during class. Rather than spending time on lecture, the face-to-face time in class is dedicated for students to focus on committing their content knowledge to practice by working on thought-provoking activities. Classroom activities are purposely designed by the instructor to promote higher-order thinking skills on Bloom's taxonomy, where students apply, evaluate, justify, and synthesize their understanding of the concepts examined in the video and correlating text. And because videos are accessed electronically, students always have access to the foundational content during class activities. The structure of the face-to-face class shifts too, allowing the students to work in small groups to discuss any questions they had from the videos, do lab experiments, or participate in peer instruction. Instructors then serve as coaches or facilitators of learning, where they encourage students to think more deeply about the content, and they answer student questions one-on-one or in small groups instead of speaking in the front of the classroom on global questions that may not apply to all students. The flipped classroom is not an opportunity to do more, but rather a way to build efficiency in the delivery and application of the content.
There are considerable learning benefits for students who participate in a flipped classroom. The flipped model for learning is supported by DC and Ryan's self-determination theory, Miller's cognitive load theory, and Zimmerman's self-regulated learning theory. Altogether, research supports the notion that flipped classroom provides students with more control and input in their learning. Through interactions with flipped lessons and class activities, students can monitor their cognition, maintain metacognitive awareness of their strengths and weaknesses, and devise a strategic plan for their learning and thinking. In other words, the flipped classroom puts the learning in the hands of students, leaving the instructor with more opportunities to shape their instructional practice towards individual students' needs.
There is no one way to flip a classroom, as its structure is representative of the instructor's style and preference. A common design framework for the flipped classroom is to provide students with a 10 to 15-minute video lecture prior to class that is assignment-based and requires students to produce some work, like writing questions, synthesizing, or solving problems. Active learning strategies that encourage student engagement can be designed for face-to-face class time. Instructors may decide to design activities where students work collaboratively on clinical problem sets, simulate patient care, or problem-solve in case-based approaches. In all scenarios, students are required to apply what they learn through advanced reading and instructional videos.
Ultimately, the flipped classroom model has a multitude of teaching and learning benefits, and it can be tailored to fit the teaching style of the instructor. By providing students with opportunities to rely less on the instructor as gatekeeper of knowledge and engage actively in their learning, students are better equipped to regulate their ongoing learning beyond the classroom walls.